late, so I think we can start this session. Greetings all and welcome all. And now I would like to welcome Dr. Kelvin, who's the moderator for today's session, who will be taking care from here. Dr. Kelvin, please proceed.
Thank you. Thank you very much, Sonia. Greetings to each and every one of us from wherever you're joining us today from. We are very grateful to have you join us today. My name, as Sonia has mentioned, is Dr. Kelvin Odongo. I'm a pharmacist by profession and currently work with African Pharmaceutical Network. We are very glad to have you join us in our webinar series that are meant to really focus on capacity building and knowledge sharing. As African Pharmaceutical Network, we are very big on collaborations that further the agenda around capacity building and knowledge sharing across the globe. And it is for that reason that we reach out to partners across the globe who are positioned strategically to be able to address these subject areas. It is in that regard that we also partner with Empower School of Global Health, and I'll give a brief moment in just a few to Dr. David Odhiambo to tell us a little bit more about African Pharmaceutical Network, as well as Sonia to tell us a little bit more about Empower School of Global Health and our partnership. But before then, ladies and gentlemen, allow me to walk us through what the agenda of today's call will be about, but also to walk us through the roles of engagement in terms of how this webinar series will be held today. Okay, so our topic today is going to be on the impact of regional pooled procurement of health products on access to affordable quality medicines. Okay, and we are very privileged to have one of the best experts in this field. And what we aim to do at the end of this is really to be able to gain from the wealth of knowledge and experience from Professor Andy based on his direct observations. So very quickly, with regards to our housekeeping rules for all our participants, I ask that you kindly mute your mics and turn off your videos at all times through this webinar. Please ask your questions using the chat box or by raising your hand, and someone in the background will be able to respond to them or pick them up. Please also participate with us in the polls that we are going to share with you. We find these polls very important to be able to get feedback from you and build on this feedback to make future webinars more targeted and more beneficial to our audience. Okay, I should mention that the webinar recordings will be shared and will be available on both the Empower School of Global Health YouTube channels, as well as the APN YouTube channels. We'll also share the slides from this presentation afterwards, and we should be able to offer you, as well as our participants, a certificate recognizing your attendance to today's webinar session. All my speakers for today and the moderators, I will ask that you turn on your camera. Thank you, Prof, for having your camera on so that we have a better engagement. But please also mute your mic in the event that somebody else is speaking, and let's adhere to the webinar timings. So just very quickly, David, I want to welcome you so that we are able to then talk very briefly about African Pharmaceutical Network, and then I'll give it to Sonia to talk about Empower School of Global Health, and we'll quickly jump to our first poll for the day. Welcome, David.
Thank you so much, Kelvin. So it's a pleasure to be here with all of you guys, and it's a pleasure to share with you as we continue learning. And as Odongo has mentioned, I'm Odhiambo David. I'm one of the team members running African Pharmaceutical Network. And just to give you a brief background, African Pharmaceutical Network is a platform that brings together pharmaceutical industry stakeholders and players in the African landscape. That is from organization to individuals working in the pharma space or having an interest or an inclination towards supporting the development of the African pharmaceutical landscape. And our main commitment and objective is to ensure that we're able to deliver reliable, quality, effective, and safe medical products and services to the African populace in a timely manner to ensure that whenever we are talking about diseases and everything, we are guaranteed that whichever disease that we are going to impact our people, they have access to the therapeutics, they have access to the competent people who are able to ensure that we have these medication and these products available for them and in an affordable manner, because the reliability and affordability without those being in place, then however safe or how effective the quality medicines are, people will never use them. So we have to look at how that access comes in. And based on that, then the question that you ask yourself is, how do we support that mission, that bold ambition as an organization? When we look at it in terms of our inclination and our focus is to ensure that, one, there's competent professionals. There's never a way that you'll be guaranteeing us that the research and development of pharmaceutical distribution and supply chain coordination, and even the pharmaceutical care next to the patient at the point of care, will be delivered on unless we have qualified and competent persons. So in that case, then we are looking at having these capacity building programs where, one, we start with knowledge sharing, where we have webinars, we have information sessions, experts in the industry sharing their experiences, their perspectives, and the opportunities that are happening in those places where, as professionals, as individuals, we can take advantage of these, learn and position ourselves to be experts to drive the growth as we hope for. That is one. Beyond the knowledge sharing, we have the training and capacity building, where we now have programs and courses that are being delivered on. And those courses, there are those that we are driving and running as APN on our own account. For example, we could talk about the regulatory affairs short course that we're already in the fight. Cohort 1 is almost coming to an end by the end of June. And there's going to be a cohort 2 starting officially in August. These are training programs that, one, are based on what are the current market needs in our markets? What are the emerging trends? How do we close those gaps in skill set to ensure that our professionals are able to drive the growth and the trajectory of development in the African pharmaceutical landscape? And those are things that we are hoping we're able to achieve on. But then beyond capacity building and knowledge sharing, when we have the competent professionals, they don't work in silos, they don't work in isolation and in space. They work in an ecosystem. And that ecosystem means we are dealing with regulations, we are dealing with policies, and therefore our key aim is, if you're competent enough and you know the needs in your ecosystem and the services that you should be delivering, are the policies and the regulatory frameworks enabling for you to be able to deliver that quality care? If the policies and the regulations that are in place are not enabling you to do that, then that is a hurdle and a bottleneck. And those bottlenecks are the main things that will make it not possible for you to be able to serve your patient, to be able to supply the medicines, to be able to get financing for your pharmacy that you're running, or to be able to even coordinate your digital technology solution to ensure that digital technologies are integrated into our pharmaceutical system. So how do we shape those policies? Engaging and collaborating with regulators, with the healthcare regulatory agencies and all that. But the aim is we bring a consensus where we are seeing, we are not only talking about it, but talking about what needs to be, how it needs to be, and we are moving the cog to the next phase. Then finally, beyond that, we are looking at the next phase where now for the individuals and engagements that we're having, are we able to partner with people to deliver these technologies? You have an enabling environment. You are competent and qualified to deliver the services. But unless you are employed or unless you have a business that is running and delivering the services, the patients and the general public will never have those services. So the services have to be made accessible. That is where we come in the phase that we can now collaborate with you, co-create solutions, co-create interventions and solutions, and we bring them to the market. And that could serve in terms of either partnering to design a solution or partnering to offer consultancy or technical expertise to you to be able to deliver on that. And that is what we are hoping to do. And we encourage and ask you all, please join us, let's work together, and let's make this moving forward, because that is how we engage. And I'm glad that Empower is here with us, and Empower as a partner focusing on capacity building. We have the academic component. We are doing some capacity building and knowledge sharing. Then we now infuse that into policies and real interventions that are going to ensure that our people have the services they need. Thank you so much, and back to you, Kelvin.
Thank you. Thank you very much, David Odhiambo, for that brief intro about African Pharmaceutical Network and our collaboration with the Empower School of Global Health. Sonia, at this point, I want to welcome you very briefly to also walk us through what Empower is about.
Thank you, Dr. Kelvin and Dr. David, for your words to the participants. And I really happy to see a very good number of participation in this webinar. So now I'll just briefly go through you all with the Empower School of Health. Just give me a sec. Yeah, so about Empower. Empower is a capacity building organization and has worked over 100 countries across multiple languages to strengthen the institutional and HR capacity of global health and humanitarian program. Our reach, you can see over here, we have already reached out to 200,000 public health professionals globally. And we have 3 focus areas: leadership and change management, digital learning, public health, procurement, and supply chain. On the bottom, you can see the domain areas we have. There are in total 5 domain areas. And on the left-hand side, you can see our clients with whom we have worked for and we have worked currently also. So for more information about us, you visit our website, that is Empower School of Health. And we have recently launched our educational website. The link will be posted on the chat. As I explained to you in the last slide, we have different collaborations and we are working with different institutions and university. And this slide will give you the idea about our global reach in Africa region specifically. These are our partners. We are collaborating in the same way that we are collaborating with APN. And this is the the first session of this year, and we will be having more in this year. Everything will be posted on our social media platform and APN platform. This slide will give you an idea about our advisory and faculty member, Professor Paul Lalwani. He's a director in Empower Group, former head of Global Fund, Procurement and Supply Chain Division. Professor Andy, he's the director training and capacity building, and he's our speaker for today's session also. So now I'll just give the floor back to Dr. Kelvin, and I would request Dr. Kelvin, please just introduce poll 1 because we have missed in the previous slides, and then we will proceed further with Professor Andy's introduction. Thank you all.
Thank you. Thank you very much, Sonia, and thank you. I see our audience is growing. We are very delighted to have you here. Now that you know a little bit about APN and you know a little bit about Empower, we'd also love to hear a little bit about you. So Sonia, if we could go through a poll, if you go to the poll and we could have our participants just responding to us. So team, just very quickly take a minute or two and just respond to the questions that you see on your screen. And this is really to help us also understand the backgrounds of our audience, where you're joining us from, what your background is professionally, what is your age group, and it helps us as well to be able to know the reach of today's session. So please take a minute, and I see we've already started participating. Thank you very much. So just take a minute and quickly respond to the polls, and then we'll go through them together in just a minute. Thank you. I see our responses are coming in. We are at 10 out of 88, so keep them coming, guys. Keep them coming. You're doing so well. We're at 15, 17. Great progress so far. I see a lot of attendance from Kenya here. I see elsewhere being majority at the moment. Majority of our participants today are between 30 and 40 years old. Male are dominating in terms of attendance so far. Keep them coming. We are almost halfway there in terms of our responses. So West Africa is quite dominant as well in terms of attendance today. That's very impressive. Yeah. And in terms of academic backgrounds, I see here Bachelor's of Pharmacy degree currently at 47%. We have non-pharmacists joining us at 17%. We have PhD holders in pharmacy at 2%. Prof, I suspect this is you. Then I have a few other individuals. So we have pharmacy technicians as well. So literally, our audience is quite rich in way of scope. Thank you. We are at 57 and counting. So keep your polls coming and your responses. So Sonia, maybe just one more minute and then we can proceed. Thank you for also letting us know how you heard about this webinar. It's also very helpful so that we know which channels are working in terms of reaching our audience and where we need to be able to leverage to communicate to you effectively in way of future webinars and future engagements. I can see here in terms of wealth of experience in the industry, in the various industries. So majority of us are actually at less than 5 years in practice. So we're hoping that this webinar series is going to be very informative as well as you carve out your path in your career and as you decide which areas you want to really engage in. We are hoping that this will be helpful. Sonia, there's somebody who's mentioning that they can't access the poll.
Yes, I believe that there might be some internet issue with that particular person. So I would request him or her to please check your internet connection or just reapply again. Reattempt again. If still the
Mhm.
problem persists, that's okay. We will take a note and we will do the necessary for the next time.
Thank you. Thank you for that, Sonia. All right, so we had 67 people in terms of responses out of our current attendance. So if you could just have 1, 2 more responses, and then I can give us a summary of how of the data that we have here. Okay, so 73% of our attendees today are males, and we have 25 being female. I can see that majority still stands at 30 to 40 years in terms of attendance, with below 30 coming in at a close second. And then we have 40 to 50 years coming in at the third with 22%, and more than 50 years, about 7 participants today. That is very helpful. In terms of geographical spread, so elsewhere actually takes the lead. So we have people from the global space at 42%. And then we have coming in also very closely is Kenya at 19%. Actually, West Africa is at 21%, then Kenya at 19%. And then South Africa, wow, nice. About 9 participants coming from South Africa. And then we have Central Africa at 4%. In terms of academic background, pharmacy bachelor degree holders, a majority today. Then we have other coming at 19%, so other professions that are not necessarily pharmacy related. And then non-pharmacy, completely non-pharmacy related are at 18%. Pharmacy technicians come in at 9%, tying with pharmacy with advanced degree. And then lastly, a pharmacy with PhD at 1%. Okay. And then finally, we have working professionals being the majority of today's call at 73%. Just a minute. So working professionals and then students are coming in almost tying with both student and working professional. Lastly, years of experience. So here we have a tie between less than 5 years and 6 to 10 years. So that just gives you an overview of the kind of audience we have today. And then 11 to 15 years at 19%, and over 15 years we have at 21%. Thank you very much, our participants. We have 67%, 71% participation in this poll. Sonia, if you could go to the next bit so that I'm able to introduce Prof. Thank you. Thank you very much. So once again, ladies and gentlemen, it is that time that I take pride and a great honor to be able to introduce our speaker for the day. So our speaker for today is Professor Andy, comes to us from Empower School of Health. He is the Professor of Public Health and Director of Capacity Development at the Empower School of Health. He's also one of the co-authors of the Yellow Book, as it's known, Managing Drug Supplies by MSH and WHO, and the e-handbook of Health Systems in Action. He has over 30 years of experience in working with major international funding institutions, bilateral donors, and the private sector in low and middle-income countries. The main focus of his experience includes effective management of pharmaceuticals, vaccines, and medical commodities, and especially in the implementation of programs for the introduction of new medicines and rapid diagnostics for neglected tropical diseases. I should add that he has undertaken donor-funded activities in over 40 countries, from provision of family planning commodities and the responses to early onset of HIV in the 90s, through the Global Fund grants in the 2000s, as well as essential medicine provision in conflict zones and extensive training in the quality of medicines. Most recently, Prof has authored the Goan Supply Chains of Emergencies Response COVID-19 platform, pandemic preparedness training modules, and the master's degree course at Empower. Ladies and gentlemen, join me in welcoming Professor Andy. Prof, you're welcome.
Greetings, and thank you for the introduction. Can we go to the next slide, please? Greetings to all. I'm going to speak rather fast, but you will receive the slides and you will receive the recording of the webinar. So we're really going to talk about regional, that is multi-country, pooled procurement of health products. Next slide, please. And really, the point of my presentation today is to bring out different aspects of pooled procurement. In the past, when we've mentioned pooled procurement of public health products, everyone has focused almost entirely on the buy price and the economic cost savings. And whilst that's important, it's not everything. And I believe we have seriously neglected the other aspects of pooled procurement. And one thing that COVID must have taught us is that we need to make our supply chains for public health products far more resilient. And my message today is that pooled procurement can help, can assist us to achieve some of that resilience. Because too often, when we've looked at resilience, we've said, it's too expensive, we can't do that. I want to try and bring the message that by re-examining pooled procurement and focusing not just on the economic impact, but on the availability, the access, and the resilience of the supply chain, we can bring post-COVID realization to our supply chain. And the multi-country regional pool procurement has got many conditions and many requirements, but it can bring benefits if we can drive the political will and overcome those barriers. Next slide, please. So pool procurement is a term that's often misunderstood, and it's open to very broad interpretation. So I'm going to use the World Health Organization definition of it. That is a formal agreement where financial and non-financial resources are combined across various purchasing authorities to create a single entity for purchasing health products on behalf of the individual purchasing authorities. So throughout this presentation, I'm going to stay within the WHO definition. And I think the key point around pooled procurement is that we are going to organize the buy side, the procurement side of it, to drive efficiencies on the supply side, and especially resilience and availability of products. That's the key point of my presentation today. Not just the economic aspects, but bringing this resilience aspect to our supply chain. Next slide, please. So there's been major misunderstandings around pooled procurement because everybody focuses on this price aspect. Oh, it's cheaper, and they neglect all the non-price benefits that pooled procurement can bring. That is assured quality, availability, administrative efficiency, bargaining power, a key point that I'm going to talk a lot more about, improved capacity to forecast, and collective technical expertise. So again, buy price is important, and I don't want to neglect that, but it's not everything. Resilience is key. If we've not learned anything from COVID, then we're going to be in the same position again the next time a pandemic or an emergency happens. We must make our supply chains more resilient. And pooled procurement offers a way to do that. COVID did not create many of the problems. We already had those problems in our supply chain, but COVID highlighted those problems of just how fragile our supply chains were and how we must drive better resilience. Next slide, please. So if we look at all the different reviews of pooled procurement, and many have been made, we find that the vast majority, 28 of them, all focus about the buy price, this cost containment. They're all around the economic aspect of pooled procurement. In fact, when Sabin and Aiton looked at them, they couldn't find any that discussed anything else. In fact, there are a few papers which do review pooled procurement and analyze it for other areas like availability, quality, and process efficiency. So those are there, but they're neglected. People aren't looking at them. We've got the evidence, we've got the data, but we're not considering it. It all gets neglected because price is king and has driven everything. And again, I'm bringing this point, we need to look beyond just the price at the benefits that pooled procurement can bring. Next slide, please. So the key message I want to bring is this resilience and availability and the scale of operations. And I think that's key to bring the scale of operations. And it's not just pharmacists who've recognized this. We look at the African Continental Trade Report. It's impacting major trade as well. Pooled procurement frameworks, yes. Again, recognize that we are importing 70 to 90% of our medicines into the regions. Okay? So we have a fragile supply chain. We're relying on the international supply chain. Not even within our continent. The vast majority of our medicines come from India because they're a lot cheaper and many generic formulations are available. But that brings other problems as well, which I'll explain in the next few slides. So again, look at resilience and availability and be realistic in considering resilience about the buying power that we have. Next slide, please. Well, the impact of the COVID pandemic has been massive. But if we look at it outside COVID, we've really slipped on malaria supplies. What's COVID got to do with malaria? It shouldn't have made the impact it did. There's no relationship between COVID and insecticide-treated bed nets. And yet we've had massive supply chain disruptions because we allowed our supply chain to become exceedingly fragile. COVID has highlighted those problems that existed. And many of our major health programs have been impacted by COVID because we have not been resilient. We have no extra stock. We have no availability and ability to respond to supply chain disruptions. Next slide, please. So this supply chain fragility is largely because we've allowed our procurement of health products to focus on just a few producers, a few suppliers. And you might say, well, that's not true. We have hundreds of them. But if we take the case of pharmaceuticals, well, we buy them from India. We buy them from 20 or 30 different suppliers. Yes. But where does India get the API, the active pharmaceutical ingredient, to make those pharmaceutical products from? Well, 90% of it comes from China. And guess where in China? A city called Wuhan, the first place where the COVID was identified. Wuhan is the center of API manufacturing for around 25 APIs. And most of the APIs in the world come from this city and the region around it in Hubei province. So we allowed our supply chain, we never thought about this. We allowed our supply chain to become exceedingly fragile and reliant on just one or two producers. And we were driven that way by economy of cost, because many of our countries are relatively small to medium populations and don't have a lot of buying power. So we tried to concentrate to increase our buying power. But we see by doing that, we make our supply chain very fragile. Next slide, please. If we look at the Global Fund survey of availability of HIV, TB, and malaria medicines at central medical stores, This is from last year. And we can see they were into high and medium risk as we went through the year. Indeed, the target for this year is that only 15% out of stock on antiretrovirals. These are life-saving medicines. Surely we can do better than 15% out of stock. We should have 0 out of stock on these items. But we've allowed our supply chain to become so fragile that the slightest disruption, the slightest delay in delivery means we're in an out of stock situation. We have to address this fragility. We have to become more resilient. Next slide, please. We need greater resilience. I've used that word a lot already, but what exactly do we mean by resilience? And again, I'm going to use the World Health Organization definitions. The adaptive capacity to prepare for unexpected events, respond to disruption, and recover from them by maintaining operations. That's the point of resilience. Expected disruptions I can plan for, I can do buffer stock. I need to have resilience for unexpected. No one expected the COVID pandemic, but we got it and we were not ready for it. We have to be better prepared. We have to be more resilient for the future. COVID's happened. There will be other epidemics and pandemics and disruptions. And we have to be resilient in the way that we operate our supply chain. Next slide, please. Well, how do we become more resilient? And the simple answer is we use risk management. We use formal management techniques to identify the risks. And there are excellent publications available on exactly how to do that. And Empower runs training courses as well on how to do that. Identify the risks and then try and mitigate the risks. Well, we can't control earthquakes and hurricanes and other natural disasters, but we can be better prepared. So if they happen, we can be ready, we can respond to them. It's not going to cause such a massive disruption of our supply chain. This is the mitigation, being ready, being prepared for them. And risk management brings a formalized structure to that operation of how we do that in a systematic and cost-effective way. Next slide, please. Well, what does that mean for healthcare procurement and supply chain? What's it got to do with pooled procurement? This is supposed to be a webinar on pooled procurement, and all I've done is talk about resilience so far. Well, one of the ways we get resilience is that we change the way we do procurement, because what we have been using are inefficient and frankly archaic methods. Many countries inherited them from colonial times. They're over 30 years old. They weren't very good then, and they're not appropriate at all now. By changing the way we do procurement, we can increase resilience, and that brings us to pooled procurement. So one of the ways we change procurement is by going to multi-sourcing. What happens now is we're often forced into annual tenders, and it's winner takes all. Whoever wins the tender, he's the supplier for 100% of that product. That's not multi-sourcing. What we're saying is to become more resilient, we have to go to multi-sourcing. Next slide, please. So one of the ways we can do multi-sourcing, it's a way that all the UN agencies and WHO users, South Africa has been using it for some years as well, is instead of 100% tender award, we do an 80-20 split. We don't have to do it for every item, but we can do it for the critical items. Most of you will be familiar with Venn analysis, vital, essential, non-essential. We can identify the vital items, and for those items on the tender, we do an 80-20 split. That is One supplier gets 80% of the order, another supplier gets 20% of the order. And the point about those splits is we don't just look at different suppliers who are taking different API. They're getting their API from a different place. So that if there's a disruption to the API, as there was in Wuhan with COVID, we're not going to suffer as much. So 80-20 split for very critical items. Some countries go to 60-20-20 split. Well, that sounds really easy, doesn't it? That's simple. We can do that. No problem at all. Next slide, please. This data is taken from Uganda. So if we look at the bar chart at the bottom, we see the lowest price, we're going to assign that 100%. And the second lowest price was 159%, because it was for a lot less quantity. It's only for 20% of the main order. So if I do an 80-20 split, you look at the line now for 80-20 split award, it's going to cost me 11.9% more, 12% more to do an 80-20 split, because the price of the 20% is a lot higher because it's a lower volume. I'm also not going to the lowest tenderer, I'm going to the second lowest tenderer. So there's a price to be paid for this kind of resilience, for this kind of activity of building a split tender. And if I went to 50-50, it would be a 30% extra price award. Next slide, please. Now, what do you think your reaction will be if you go to your Minister of Health and say, dear Minister, I want an extra 12% to build resilience in my supply chain? Well, every minister I know would go ballistic if I wanted 12% more. So how can I do this? How can I bring this supply side resilience without increasing the cost? And the way is, of course, pooled procurement. And that's the point of the whole webinar that I'm bringing in. We focus too much on the cost and not on the other aspects like resilience. So the pooled procurement will bring my cost down of this 12% because my 20% is now a much larger volume. It's pooled across 5, perhaps 10 countries. I now will only have perhaps only 1 or 2% increase in the price to do an 80-20 split because I've got a much bigger volume. This is the advantages that pooled procurement brings. It allows me to do multiple sourcing. And multiple sourcing means greater resilience. One supplier defaults, I can at least get some supplies from another supplier until I can address the supply chain disruption. And that's a real advantage that pooled procurement can bring. Next slide, please. Look now at the buying power. Generally, classed together is Middle East and Africa. We take the whole of the regional population, it's around 1.3 billion people. Yeah? It's only 3% by value of the global market. If I pooled every country in Africa in the Middle East, my buying power is 3% of the global market. Which supplier, which manufacturer is going to take notice of me at 3%? So that whole market area of 1.3 billion people is buying the same amount of medicine by value as the UK, with a population of about 70 million. That's the discrepancy. That's the difference in buying power. So if an individual country, you're trying to buy on the international market, you don't have any buying power. It's not there. Even if I pulled the whole lot, it's not there. So recognize the difficulty we have on buying power that drives us towards pooled procurement. It's one of the other areas that we have to have. Next slide, please. So this example is from Tanzania, chosen because it has a roughly similar population to the UK. So population of Tanzania around 61 million, the UK around 67 million. Okay, so the total pharmaceutical expenditure in Tanzania is $315 million, and in the UK is $16 billion. That's what you're up against. How are you going to compete when one country is buying so much more than you? But now, many of you will be familiar with the term SADC, Southern Africa Development and Cooperation Countries. And they've been talking about pooled procurement of medicines for many years. And they've done various surveys. Their survey is if they could get the SADC countries to come together, they would have a buying power of around 4 billion. Okay, still less than the UK, but it's a lot better than 300 million, isn't it? I've now got a buying power that starts to look like I can compete with European countries. I might have a chance of obtaining some product now. As an individual country, even a moderate-sized population country like Tanzania, you don't have the buying power on the world market. As a regional pooled procurement, you do have the buying power. You can have hopes now of multi-sourcing and of commanding respect in the marketplace. Still low, but a lot better. Next slide, please. Well, does this pooled procurement really work? Well, there are many examples of it does. Here we've got 29 empirical studies. Does it work? Yes, it brings price reduction. But more importantly, improved availability. You're increasing your resilience with pooled procurement. Availability of essential medicines increased. You're more resilient. You're less likely to have disruptions. These are the non-financial benefits which have been so neglected in pooled procurement, and especially advantageous to countries with limited purchasing power. And let's just think about the low population countries, Botswana, Namibia, Lesotho. They are trying to buy less than one hospital in Europe on a national buy. Really need to have pooled procurement for low and medium population countries. Next slide, please. What examples of pooled procurement? In the Gulf cooperation states around the Arabian Peninsula. And I think that's particular importance because I'm going to mention that again in some of the conditions. Even Europe has an interpooled cooperation agreement. South America through the PAHO, the Health Organization for Pan American Health Organization, a bit like WHO for South America and Latin America. Eastern Caribbean states, lots of tiny little islands in the Caribbean. Very low buying power. They come together in the Eastern Caribbean cooperation. That's been working for many years. So there are examples of success stories around. Next slide, please. So the point around this is we can lever the economies of scale to increase availability and increase access. And PAHO, the Pan American Health Organization in South America, has certainly put success stories there of how it's helping them to come towards universal health coverage. Not just the price, but improving resilience, improving access, using multilateral pooled procurement. Real examples of it working there. Next slide, please. Well, what does it need to be a success? Well, unfortunately, a lot. You need to have a lot of conditions in place. You need to have a lot of work to bring it together. Firstly, you've got to have really strong political will across countries. You've got to have common cultural and linguistic governance. So one of the reasons why the Gulf Cooperation Council pooled procurement works so well is because all the countries speak Arabic. All the material is labeled in Arabic. It's all produced to that standard that they require for their conditions. It takes time to develop and align the countries. You've all got to agree to use the same medicines to the same standards in the same packaging and the same conditions. Lots of standardization, and it means giving up some sovereignty as well. You're no longer in complete control. You have to agree with the regional aspects. It's not easy to put it together, and it does need very strong political will and stakeholder support. Next slide, please. Pooled procurement has always tended to focus on cost containment. Yes, that's there, but there's much more to it. And we've got to consider resilience and access availability far more. Post-COVID, we've got to become more resilient. Pooled procurement is one of the tools we might be able to use to help bring that resilience. It's not easy to do. It requires a lot of will and a lot of effort, but the results are frankly astounding when it does work. Okay, I'm well over time, so I'm going to stop now and hand you back.
Thank you. Thank you very much, Prof, for those insights. That are very helpful in terms of defining what the problem is and going through what exactly can we do about it, what exactly are people already doing in that space. And I see there is quite a bit of feedback as well in the chat about people just expressing how frustrated they have been in convincing the authorities, as you rightly put it, to get on board with this idea. And how do we then move from here or from where we are to avoid another COVID situation that we actually highlighted very clearly, the weaknesses that we have in our supply chain, and how do we make sure that that does not happen again. So thank you very much for those insights, and thank you as well. I see some questions have started trickling in. We will have a Q&A session for you just before we wrap up. But at this point, I want to welcome Sonia back to walk us briefly through the Empower courses. Thank you.
Thank you, Dr. Kelvin. Thank you, Professor Andy, for your presentation. And it's always a great exchange of knowledge with the participants, and we are happy to be a part of it. So now I would like to briefly introduce audience about the Empower courses that we offer. More information you can check on the website, but I'll just give you the brief information about it. So we have a master's course that we have recently launched. In master course, we have two categories. It's for 12 month course. Then we have a 12-month course, PGD course, then 6-month course diploma, and we have short courses. The slides will be shared with the participants so they can have the information about the courses and everything. The link is also on the slide deck, so they can simply go to the website and check about the courses. So the certificate courses, they are for 2 months, and you can see the fee information and how to enroll it by applying to the course by visiting the website. So there is a apply now option. Now I'll just announce about the master's course, basically what is the fee structure and how we, we also have some partial scholarship that we are providing to the students who are, coming. Scholarship for those. So the original fee structure for master's 24-month course is 8,000 USD. This is exclusive of all taxes and bank charges. Then for master's 12-month course, this is specifically designed for PGD graduates from Empower School of Health. And the original fee for this course is 5,500 USD. For PGD course, the original fee is 2,500 USD. So in order to apply for the partial scholarship, either you can get connected with us by by contacting us on the email ID that is mentioned on the slide deck. And also you can get connected with APN for your recommendation from their side. The process for applying for the scholarship, partial scholarship, as I mentioned, you can get connected with us on operations@empowerschoolofhealth.org. This is the email ID of Empower School of Health, and also APN members, they can reach out to APN directly, Dr. David or Dr. Kelvin for the partial scholarship. For all the information about the Empower courses, the link is posted over here. You can click over here to know about all courses. Now I would like Dr. Kelvin to take it from here. Also, the certificate of participation will be shared with all. The link will be posted on the chat box. The presentation, the YouTube link, everything will be provided to all attendees by email post-webinar. And also, since this session is live on Facebook of Empower School of Health, so you can also check recordings from there till the time. Thank you so much.
Thank you very much, Sonia. If you could end the poll just briefly, and then we come back to it. Hello?
Yeah, it's probably not possible to relaunch
Okay.
the poll, so we have
Yeah,
to go with it.
no problem at all. Okay, so thank you very much, Sonia, and thank you as well, Prof, for walking us through once again. I think my highlights is the definition of resilience, what exactly it is, how do we then, having identified the problems that COVID highlighted really and brought to light, how do we then check this over-reliance on one producer of APIs, and how do we make sure that we leverage on the collaborations amongst various scopes in terms of countries or regions to make sure that we improve our buying power as well. It's interesting what you've highlighted, the difference between Tanzania and the UK in terms of the buying power, and how coming together as regions would actually help ease some of that pressure that individual countries also experience. So thank you very much. And to our participants, I want to welcome us to our second poll, and I can see we're already getting responses, after which I'll welcome David just very briefly to speak a little bit more about the scholarship programs that Empower School of Global Health offers, as well as just speak very briefly about the APN Regulatory Affairs training course. Okay, as Sonia has mentioned, as a member of APN, then you get a scholarship, and so you're able to then access the courses highlighted at a more subsidized rate. So we welcome you to join us and be able to benefit from this. Our second poll, we, as I mentioned, are really seeking to know, are such webinars helpful to you? How can we design them to make them even more impactful in the areas of your interest? Feel free to suggest, even in the chat if the questions are not here, what else you would like for us to talk about, all right? With regards to future webinars, as I mentioned, we are very big on capacity building, and partners like Empower School of Health make this possible, all right? Would you like to receive more information on any of the topics? Please feel free and let us know. So I see we already have a lot of responses asking for more topics on supply chain or more information on supply chain, on HR for health as well. I see majority of our participants today are very keen on working in the supply chain space, all right? And we are hoping that as APN and as Empower School of Health, this webinar has been helpful and informative to you, okay? Majority, we see quite a huge chunk of our participants today also interested in supply chain courses, so 88% of those. And we're hoping that some of the offerings that have been highlighted or will be highlighted as well by David, you'd find them very helpful, okay? Some of the other courses, we have global health taking lead as well in terms of an area, and pharmaceutical management as some of the areas that our participants are very interested in. So we're hoping that as you go through the the links and the websites shared by both APN and Empower, that you would find the information there very useful in making your decision and also being supported to effectively pursue your areas of interest. So thank you very much. I see we are at 12:57 East African time. So I am going to stop our poll at this point. So we have had 56%. Thank you very much for your participation today in the poll as well. So David, at this very moment, I want to welcome you to talk very briefly about the APN course offerings as well as the scholarship program with Empower School of Health. Thank you.
Thank you, Kelvin, and thank you everyone for the robust participation, for the engagements. I've just stayed on the charts the whole session, and I really appreciate that. It shows that we are learning, we are engaged, and we are sharing our perspectives and willing to move forward in terms of improving access to care. From what Prof. Andy has shared, the key thing is ensuring we have resilient healthcare systems, resilient pharmaceutical supply chains, and that starts from quality, ensuring we have the right quality, delivering the products, and ensuring that the system works. The way to do that is to ensure that the persons doing the work are competent enough to be able to deliver on that. And that is where their training programs are being offered. So for me, what I would say is for the regulatory affairs course, as you're already seeing on your screen, one, we have a regulatory affairs course, and this is a short course that is based on local industry trends and dynamics and looking at what particular skill set you need as a regulatory affairs professional. From dossier compilation, dossier submission, review processes, and the guidance, the specific nitty-gritty that you need to understand in terms of that. So we deal with regulatory affairs in pharmaceuticals, biopharmaceuticals, medical devices, and clinical trial work. Then ultimately we finish it from a point of business, because you're not doing regulatory affairs for the sake of doing it, but you're doing it in the context of an organization. So the business fundamentals of regulatory affairs, and also beyond the business fundamentals, do you understand the regulatory policy landscape? What contributions can you have to ensure that that is moving to the next frontiers? So those are some of the key kind of contents that we're doing, and it's a 10-week course. It has 8 modules and 2 guest lecture sessions that you're offering. And just to let you know, it's a CPD accredited by the Pharmacy and Poisons Board in Kenya, and it is supported by the FIP, the International Pharmaceutical Federation. So the second cohort will be rolling out in August officially. So currently the recruitment is ongoing. When we get to our target number, which is 25, we'll close out on that class. So the earlier you book your slot, the earlier it gets for you, so that you don't miss out on a subsequent cohort. Beyond that, in terms of our partnership for the supply chain related programs, you've already heard from Sonia in terms of the scholarship, the courses that they're offering. One, there is the Masters in Pharmaceutical Supply Chain, the 24-month one, which is 8,000. Under APN, if you are a member of APN, or we get to recommend you for the same, then you stand a chance of getting a partial scholarship, which would reduce it to around 6,500 USD. So that is an extra 1,500 USD that will be waived on your cost. The same applies for the 12 months option course, that is for the 12 months master's program. It is only for those who had already taken the postgraduate diploma program. And therefore, for that postgraduate diploma, if you have the proof that you've had it, then you now apply for the master's, but indicate you've captured that, and you let us know as well. For the postgraduate diploma in supply chain, it's a 12-month course, and the course had already been recommended. There's also another scholarship that we have for that. It's 2,500, but then there's a cost that will be cut for you, and you're able to pay the 2,000 or thereabout. So those are some of the provisions. What is the criteria for you to stand to get a chance in the scholarship options and to get enrolled into the program? One, for the recommendation that we're offering as APN, we're recommending you for the scholarship, you need to be a member. So membership to APN, and I've already shared the link to join as a member. And Kelvin, you can also help me, but I'll also share it after this. Membership to APN is one thing. Two, after you confirm you're a member, you do an application on the enrollment page on the Empower website. So when you enroll for the program, there's a choice where you choose how you got to know about them, and you now indicate APN at that particular point, African Pharmaceutical Network. Then the other thing to ensure that ultimately the training is not just a matter of getting an extra accreditation and qualification, you do a motivation letter. And the motivation is to see how does the quality of the training that you're hoping to acquire and obtain from the training masters or the postgraduate diploma help you in furthering your career aspirations, one, but also in terms of delivering value to ensure you have a reliable and efficient pharmaceutical supply chain and pharmaceutical systems. So that motivation should be a one-page document that you share to us. Then once we use that, we have the motivation letter, we have the proof of membership to APN. we will be able to consolidate that and reconcile with your application to Empower. Then on that account, then you'll be able to be extended the scholarship options that are available for you. And you're hoping you take advantage of this opportunity. It's online virtual learning, therefore you're able to continue with your work, but also at the same time, continue learning. So those are some of the prospects that we're having. And we have another set of courses that we are bringing forward and hoping we'll be able to get more as we move along. And the last thing, all this information, we will share it with you on all your email addresses. Check it out, do the due diligence, share the information that you need, compile your application, and let's move together as we move along the journey. Thank you, and back to you, Kelvin.
Thank you very much, Dr. Odhiambo. Sonia, if you could go back to you sharing the screen so that we quickly jump to our Q&A session. So Professor Andy, quite a bit of responses, asking for a bit of clarifications, questions here and there. So the first question to us today is with regards to the 60-40 rule that you'd mentioned, but also I think at some point you mentioned 60-20-20. And so let me just get to it in just 1 minute. Okay. All right. So as I scroll up and get to it, maybe you can respond to this question with regards to how can we use the pool procurement principle in the retail pharmacy space?
Yes, many countries already do. Countries group together, pharmaceutical councils, buying organization schemes group together and do that. We've started a few in Ghana, in Tanzania, in Kenya, where there's group purchasing. A central body comes together. And again, that was really about obtaining access, not always about price. So in Ghana at that time, and we're talking about the 90s now, there were no pharmaceutical wholesalers outside Accra. So by establishing pool procurement systems amongst those, they were able to supply people and in fact to influence the market. So wholesalers opened up and our scheme wasn't needed anymore, but it can help to drive that kind of change. So yes, certainly there, retails can group together, and there usually are organizations that group together. Certainly in the high income countries they do. In the UK, there are many groups together of pharmacy shops that have group buying programs.
Thank you, Prof. And the next question is around, can countries also use collective pressure to influence supply investment behavior? For example, yes, to create a wider spread of API manufactured globally.
Countries is a bit difficult, but there is a system called market shaping. You'll find lots of information online about it, and it's probably been driven most by the TB program, by Stop TB. Because of the new medicines like bedaquiline for TB, there was no manufacturer there, and they helped to establish and put that together. So this market shaping is possible. Unfortunately, a single country rarely has enough buying power to do it. It requires group action, that's the pool procurement, or even global action at that level to drive it forward. But if you're going to influence the market, look at the degree that you need. If we had the whole of Africa, we've only got 3% influence on the market. That's not going to influence the big investors. So we have to bring it together as a global activity to do that. But yes, market shaping is a way to do that and address that issue. You'll find lots of documents online on market shaping.
Thank you. Thank you. And Prof, there are certain models of pooled procurement that can also be organized even by private entities. How effective do you think the group contracting model is?
Well, there are at least 4 different types of pool procurement. Group contracting can be very effective. It depends on the individual circumstances and how countries are going to cooperate together. So yes, there's no one size fits all for each group of countries. How do countries want to work together? And group contracting can be an effective solution, but it's not for everybody. It's not a universal panacea. How much a country is going to cooperate?
Thank you. And how do we implement pool procurement if we have different grants in the same country?
Well, if you've got a global fund grant, you're doing pool procurement because you must use their pool procurement system. You don't have a choice. So you're already doing pool procurement. If you've got other grants, there are mechanisms called the sector-wide approach, or SWOT, which allows you to pull together to do that. Most donors now will go with that, so they'll operate with that, particularly if you use a formal agency to undertake the pool procurement. So this sector-wide approach is available. I don't say it's easy. You've still got to drive a lot of activities, a lot of political will to make it happen, but it is possible.
Thank you. Thank you, Prof. I think finally, in the interest of time, just a clarification on the concept of 80-20 split award and the 12% increase. So somebody is asking that you elaborate a little bit on that.
Okay, if you split the tender, you're going to tender for two quantities, 80% and 20%. Let's take tetracycline. You're going to buy 1 million capsules. So you're going to tender for 80% and 20%. Because the 20% is a lower volume, it's going to have a higher unit cost than the 80%. So it's going to be more expensive. You're going to use the lowest tenderer for the 80%, but you want a different tenderer for the 20%. So not only is it a smaller volume, you're not using the lowest tenderer because you want an alternative supplier. So you've got two impacts there, and that makes it more expensive. The 12% figure comes from real example taken from the situation in Uganda. So it's because it's a lower volume.
All right. And I know I said last question, but I see one that is I think we would benefit a lot from your response, Prof. What would be the impact of having a separate procurement function from other supply chain functions? Can this split succeed in your opinion?
Yes, it can, because you can have pool procurement is often not directly linked. Multi-country pool procurement is not directly linked with that. Yes, it can, but it does need a lot of coordination, a lot of inputs, a lot of activities. It's not easy to do it, but yes, it can work.
Okay, thank you. Thank you very much, Prof. Team, I hope that I've responded, or at least managed to get Prof to respond to majority of the questions asked here. We want to be mindful of your time as well, being a work day. Sonia, I see quite a number of requests with regards to resending the link to the certificate. Please do so that individuals are able to access it. But for all of us as well who have participated in this webinar today, you'll get emails with the details with regards to the presentation today. You'll get access to the videos, and you'll be able to then get a lot more time to interact with the information we've shared here. Sonia, do you have anything from your end before I wrap up?
Yes, so thank you, Dr. Kelvin, Dr. David, and Professor Andy for your time and presentation. This is the certificate that will be provided to all attendees. The link is posted on the chat. So you can just fill up the form, and the certificate will be sent to your registered email ID or the email ID which you will be using while filling up the form within 24 to 48 hours. At the end, I would really would like to thank you, Professor Andy, for his availability for every session, generally whenever we ask for it. And also APN, Dr. David and Kelvin, for all your support to make this session successful. At the end, I would request all attendees to just turn on their cameras so we can click a picture, and that will be used in the social media. So all of the attendees have their access. They can simply, I can see people are turning on their cameras. So Preksha, Vinita, I would request you to please take a snapshot that will be used in the social media. Thank you all for your presence.
Sure, Sonia. Sonia, for that, we will request you to stop sharing the screen.
Preksha, is that better now? Are you able to see all of us?
Not all, but yeah,
A
few
lot,
cameras
yeah.
are on and we are waiting for more to switch on.
So
Requesting
we will
everyone.
give you yes, so we will be allowing 1 minute to all of you to be settled down so they can turn on their cameras. And we would really would like to take a very beautiful picture.
Good.
Thank you all. Diksha,
Right.
you can take a snapshot.
Yes, Sonia.
Let us know once it's done, so we will just wrap up this session.
Sure. Thank you, everyone.
Thank you, Preksha.
Okay.
And
Bye to all.
thank you very much. And to all our participants, to everyone, thank you, Prof. We are eternally grateful for your time, for your wisdom and knowledge as well. Thank you, and we wish you a lovely rest of the day.
Okay. Bye to all.